This is Emergency Tools for Panic and Anxiety Self-Regulation. I have compiled here some of my faster tools for self-regulation that I have used for the past 10 years or more. They've been tweaked a little bit as time has gone on, but I hope that these are some exercises that you can use immediately, learn quickly, and apply to your everyday life to help with emotional regulation. This is for our liability, so you don't sue us. But the most important thing after you've read this to pay attention to is if you are not stable, if you're feeling like you're going to harm yourself or kill yourself, you need to call 911 or you need to engage one of the numbers here, the National Suicide Prevention Lifeline, which has a text number in the crisis line. Please avail yourself of these things. This is for stabilization only. Breath cycle 1. We breathe in 1, 2, 3, 4. Hold 1, 2. Breathe out 1, 2, 3. Pause. Breathe in 1, 2, 3, 4. Hold 1, 2. Breathe out 1, 2, 3, 4. Now let's try lengthening our breathing. Breathe in 1, 2, 3, 4, 5. Hold 1, 2. Breathe out 1, 2, 3, 4, 5, 6, 7, 8. Breathe in 1, 2, 3, 4, 5. Hold 1, 2. Breathe out 1, 2, 3, 4, 5, 6, 7, 8. Now, we've done 2 cycles of this and 2 cycles of the 4 count. If you need to feel calmer and this has not made your body feel less agitated, your emotions are still racing with your thoughts, then restart this particular slide and go through the 2 cycles per circle again. In this slide, we're going to do a focus exercise to help your body feel calmer, your emotions to settle and stabilize, and your mind to stop racing. So, what I want you to do is focus on the little black hexagon in the middle of the peaceful blue circle. I want you to focus your vision on that as you slow your breathing. Slow your breathing so you feel comfortable. Relax your shoulders. Open your hands and make sure they're relaxed. Relax your facial muscles. Do not focus so hard on the black hexagon that you can't see on the sides, your peripheral vision. So now as we breathe in and we exhale and we relax our shoulders and our facial muscles and we're staring at the hexagon, I want you to notice what's on the right side of your peripheral vision without changing focus on the black hexagon. Then I want you to breathe in again, a deep breath, And I want you to relax your shoulders and your face as you relax, staring at the black hexagon. I want you to focus on the peripheral vision of your left side and what is there on your left side, never taking your vision from the black hexagonal box. And I want you to take another deep, slow breath. And as we relax, I want you to relax your shoulders and your face, staring at the black hexagonal box. And I want you to see peripherally everything around you, beneath you, above you, to the sides. And then I want you to breathe in, focusing on the box, relax your shoulders and face. Breathe out and release focus. This exercise helps your body to relax. Now I want you to look around and ask yourself how you feel. Do you feel stable? Are your emotions settling? Is your body feeling relaxed? If it isn't, relax the places that are tense. Use your eyes to look around the places you are looking in your peripheral vision and see how your neck and your face feel as well. This is your peripheral exercise to help reduce your arousal state. This is a relaxation exercise that will help you to keep your body focused and relaxed and maintain lowered arousal rates with your emotions, your thoughts, and your body. In this slide, you will notice that the square gets bigger twice. This is to remind you, while we're doing this exercise, that the square that we're going to use for our exercise gets bigger and then smaller. So now I want you to picture your seat bones. You're sitting on them, the two bones you sit on in a chair. And above them in the front of your pelvic area are the two bones on your hips where you often have your pant waistband hit or your belt ride. I want you to picture a line from the left point of your hip across to the right point of your hip, and that line goes down to the seat bone on your right and connects it, and then the line goes from the right seat bone across to the left seat bone, and then that line extends from the left seat bone up to the left hip point. When you have got that deeply in your mind, we will begin. If you need to touch the hip joints and the hip bones and seat bones to find your square, you've been given this time to do so. Now, knowing where our square is, in our mind's eye, we're going to picture that square that attaches the lines from the hip points to the seat bones. And we're going to breathe in, and as we breathe in, we're going to picture that square expanding. So we breathe in, and as we breathe in, we are going to contract that square as we breathe out. Now we're breathing out, now we're going to breathe back in. Contraction now expands, let the square expand, and then breathe out and let the square contract. Breathe in, letting the square expand, picturing its expanse through your body, and then breathing out, we see it contract. Now we picture this one more time. Breathing in, the square in our pelvis expands, and then we breathe out and we picture it relaxing and getting smaller into a square. Now relax your shoulders, open your eyes if you had them closed, and just feel your body. Does your pelvis feel more relaxed? Does your legs feel more relaxed? Does your core muscles feel more relaxed? Where is the state of your emotions? Do they seem to be less agitated? Where is the state of your thoughts? Do they seem to be less agitated? If they're still racing, try this exercise one more time. This exercise is very helpful. You can use this exercise while driving a car because you can still see the car and drive and interiorly know that square in your hips is expanding as you breathe in and contracting as you breathe out. You can do it while you're watching TV and No one knows that you're relaxing your core muscles to reduce anxiety or panic, or you can do this in an emergency. Either one is fine. Pick the situation that you most like. The key is to recognize that little line drawn between hip points and seat bones and seeing it expand as you breathe in and contract as you breathe out. You can refer back to this slide if you'd like to repeat that. Some of the things to remember while you're in a state of arousal, feeling very panicked and anxious, is that your nervous system is driving this. All emotions come from our body. So if we can calm ourselves down in our body, our emotions will calm down. So I'm going to assume that while you're doing this, you're having a state of arousal, you're very afraid, you're very upset, and we don't know necessarily what's causing it, or you may know. But what matters now is to stabilize. So first thing I want you to do is I want you to look around where you are, relax your shoulders, lay your hands flat in your lap, and identify in the room if there is nothing bad going on. And by nothing bad, I mean you're sitting there, you're breathing, your hands are relaxed. No one is hurting you, nothing is about to harm you, and you're just sitting there looking around in your room or in your car or wherever you're experiencing this anxiety, and nothing bad is happening. Since this is a PowerPoint for calming emotions and not for dealing with a crisis incident, I want you to tell yourself out loud, nothing bad is happening. And it is a time and a meditation for when nothing is really going on. You're just anxious and having a panic attack. Something triggered your panic. It doesn't matter what it was. What does matter is that we are able to look around our surroundings, lower our shoulders, open our palms, relax them in our lap, open our eyes wide. Notice the colors of everything around you. Notice the height and breadth of the place that you are. Notice the smells. How does your seat feel beneath you? I want you to look at all those and the sounds around you and say out loud to yourself, nothing bad is happening. If you're afraid to say it out loud, it's okay to say it inside. But our ears give our brains communication and messages, and it is faster if we can say this out loud to ourselves. Nothing bad is happening. Now, while we're doing this, let us breathe. If you can't remember any of the exercises in this PowerPoint, just remember breathing with shoulders down, hands relaxed, eyes relaxed, slow breathing in and slow breathing out. Not so fast that you hyperventilate and not so slow that you feel like you're starving for oxygen. Now I want you to scan your body from the top of your head to the tip of your toes. I want you to take a deep breath in, and as you're letting that breath out, I want you to go from the top of your head through your body, down through your torso, arms, hips, legs, calves, ankles, and feet, and relax each muscle. So we're going to do that again, starting at the top of our head. We're going to breathe out as we breath in and relax each muscle. So now we're going to breathe in, and as we breathe out, we're going to relax each muscle that we find. We're going to relax it until we can move on to the next. If you have to take another breath, that's also okay. But as you breathe out, let your whole body relax. And now I want you to open your eyes, relax your body, and remember, emotions start with the body. Relax your body first. Everything else can be dealt with later. And I hope this video has helped you feel calmer and less panicky and less anxious. As we have stated in the beginning of this video, Nothing is to replace your current medical and mental health treatment. However, if you are in a state of panic or anxiety and using this video, I want you to also have resources to help deal with any overwhelming emotions that you may be experiencing at this time. So I've listed in this particular frame the helplines for the National Suicide Line, the SAMHSA National Helpline, which also has a TTY number for those who are hearing impaired. I also have included the RAIN.org sexual assault hotline because a lot of anxiety and panic can be part of anxiety and panic due to rape and assault. I have included a Veterans Crisis Line because quite often I have veterans who will come across my work, and I want to provide them a resource for themselves as well. I hope that in using these exercises, you're able to teach yourself to immediately identify the muscles in your body and the tension in your body and relax it when your emotions are aroused. To notice immediately when you have an emotional response, what is your body doing, and help your body calm down so that emotions and thoughts don't overwhelm you so much that you are unable to manage the level that they're at. This, as I said before, is a stabilization video, and I sincerely hope that this has helped all of you.